Hello everyone and welcome back to my channel. This is a part 2 of the previous video where I talked about activities of daily living, and we talked about maintaining safe environment, we talked about communication, we talked about breathing, and today we're going to do part 2 of that, and we're going to talk about eating and drinking, elimination, mobility, and yes, we'll explore more of the activities of daily living. So please like, comment and subscribe and share these videos with your friends, families, or anyone who may need this video, just so I can do more videos like this. And yeah, so let's get into it. So we're going to talk about eating and drinking. So we want to make sure our patients are sitting upright. Okay, so there are patients who will be able to obviously feed themselves, so self-caring patients, but then you're going to have patients who firstly cannot eat by themselves, or need their food like modified to a specific consistency. So patients might be normal diet, normal fluids, and that's fine, but may need like assistance to eat because maybe they've got arthritis in their hands and the fingers, and they're really not able to properly hold the knife and fork, so they may have, they may need assistance with their feeding. You may have patients who need assistance with their feeding, but they're on a modified consistency, so they're probably soft diet or chopped diet. Some patients can be minced moist diet, or the kind of like the kind of most softest consistency is the puree diet, where everything is just completely mashed together. So yeah, so it's important to make sure you know what diet the patient is on. Also, patients can be on thickened fluids, so they may need their fluids thickened, either their water, their tea, their milk, any drink. So there's usually a speech and language therapy recommendation. It might be on top of their bed or in their notes somewhere, which gives you clear guidelines on how many scoops that are needed in their drink. Sometimes it's just 1 or 2 or 3, or in some cases there's 4 scoops that are needed. So it's really important to make sure patients, their swallow is okay, they're not coughing when they're eating. If they are, you want to stop what you're doing and get the nurse to come and have a look, like, why is the patient coughing? Is there any signs of aspiration? Because in that case, the nurse might have to just do a set of vital signs, look at their saturation, see is there any change in that, tell the doctor they might need a chest x-ray. So these things can happen. It's just to know what to do when things like these happen. Obviously you want to monitor any signs of choking, and you want to know the abdo thrust technique in the case of an emergency where a patient is choked, or call for assistance. Ensure patients wear their dentures at meal times. Oftentimes, patients struggle to eat certain foods, and you're wondering, like, why are they struggling? This is supposed to be a normal diet that they're on. Sometimes it's because they just don't have their dentures in. In some cases, obviously, maybe the patient might have been rushed to hospital, and maybe they only use their dentures when they're eating and they left them at home. You can ask the nurse to let the family member know, communicate with the family, and they can bring in the dentures the next day that they're visiting, or dropping some stuff into the hospital for them. And most hospitals have protected meal times. Because at meal times you don't want visitors coming in and distracting patients and all of that. We want to make sure that meal times are protected, a time for patients to have their dinner, have their breakfast, their tea time, in peace. So next, oral care. Oral hygiene is so important. It's an area that I feel like in every part of anywhere in the world, it needs improvement. Oral care to be assessed on admission and daily. Patient oral care. So there's evidence that shows that actually in the first 48 hours of patients being admitted to hospital, there's pathogens that build in the mouth, in the oral cavity. And these pathogens can lead to, hospital-acquired respiratory infections, such as hospital-acquired pneumonia, etc. So it's really important that when patients are admitted into hospital, we want to make sure that their oral hygiene assessment is done. If they have a toothbrush and toothpaste, we have it like it's there near, ready to go in the morning when they're waking up. We want to make sure if there's patients who are obviously not able to brush their teeth themselves, that we can help them with that. Some hospitals have oral hygiene packs which are available for patients who are fasting, patients obviously who are maybe NPO, nil per mouth. So it's really important to use the oral hygiene kits that are available in your hospital appropriately to help prevent hospital acquired infections related to lack of oral hygiene. So hospital acquired pneumonia accounts to 25% of hospital acquired infections. That is according to a study that was done by Magill S. et al. In 2014. So there's a whole survey study that was done. You can look it up online about there's so many articles actually about oral hygiene and the effects that they have on patient health and well-being. So use toothbrush and toothpaste where possible. Obviously all hospitals should have some spare toothbrushes and toothpaste, and we really need to encourage our patients to use these because it's part of their health, their well-being, so be mindful of some of the oral hygiene packs have little sponges that actually, if they're left in the water for too long, they can actually loosen up, and by the time you're going to clean the patient's mouth, they can get stuck in the mouth, or the patient can chew on them, or so they can be a choking hazard. So just to be aware of that. Then next we'll go and talk about elimination, individualized needs, elimination needs. So one patient might need a commode, one patient might be able to walk to the bathroom, one patient may need to be hoisted to the bathroom. That's all patients' individual needs and preferences as well. The patients might be a bit shy to use a commode at the bedside and they'll want to be hoisted in the bathroom. So we want to obviously maintain patient dignity at all times, pull the curtains, etc. All of that. Encourage patients to mobilize to the toilet. If they can walk to the bathroom, by all means, get that frame, get that. Some hospitals have a SARA study, which is probably an easier form of a standing hoist, and it's so handy. We could just, if patients would rather use that to get to the bathroom, it's better for us to use that than to just bring the commode each time. When patients are brought to the bathroom, that's a great time to be able to assess the skin. Is there any redness? Is there any breakage in the skin? Is there any purple areas that weren't there before? Any bruising? Please note that. If you're a care assistant, if you're a student nurse, just let the nurse know, because again, that might be something that's new that we might not have noticed, and it's so important to follow these things up so that they don't become worse or further deteriorate. So another thing as well, so some patients obviously may not be able to do all of those things and may go in their pad, so you want to make sure your patient's fully cleaned and that the pad fits well. When patients are being moved up the bed, please avoid using the sheets to go up. It's not the correct, appropriate way to manually handle a patient. You want to use sliding sheets and obviously receive manual handling education prior to doing that, so that you're doing it properly for your safety and for the safety of the patient. And commodes to be emptied into the dirty utility room. Personal cleansing, encourage patient independence. Honestly, like, if patients can do things themselves, let them do it. The easiest thing we can do is, if we're washing a patient, give them a cloth and let them wash their face. Most patients are able to do that, but sometimes we just do it for them. But if we let patients do that, it gives them that sense of like, patient independence, and they'll want to do more for themselves, and they want to get back to their baseline that they were before coming into hospital. Provide a complete bed wash to full nursing care patients. So there's patients who are assistance of 1 or assistance of 2, or patients who are full nursing care and they need our like assistance with everything. So your full nursing care patients, the example, are your stroke patients, patients who've undergone surgery, or patients who are paralyzed. Clean the eye. Obviously, you want to clean from the inside of the eye out. Be mindful of skin folds under the arms, under the breast, because especially under the abdomen. So yeah, be mindful of that. Make sure that area is well cleaned and dry as well. And monitor pressure areas. So where are the pressure areas? They're mainly elbows, sacrum, the neck, back of the ears sometimes, and heels as well. Always check patients' heels. Take off those socks and have a look. How do those heels look like? In most cases, those heels are just dry and they need a bit of moisturizer cream. But in some cases, those heels have broken up. They've gone from red to a purple, and now they might be necrotic. So it's really important, if a patient comes in from ED, from home, anywhere, to check their pressure areas, check for any breakage, skin breakage, so that we can, monitor it, prevent any further skin damage. Next, mobilizing. We want to make sure we have a mobility assessment on admission. We want to see how is the patient going to mobilize on this admission and what are the aids needed. And there's a care plan usually in the nursing notes for that. Does the patient need assistance of 1 or 2? What equipment do they need? Etc. And that is it for today's video. Thank you for listening. Thank you for your time. I hope it was helpful. I hope now you guys have a better understanding of activities of daily living, and that this can help you in your clinical settings, whether you're a care assistant, whether you are a student nurse, and how you can apply that. This can help you in your assignments and in your clinical placements. Until next time, bye.